Hi, I'm Trevor Crow. I'm a licensed marriage and family therapist, and welcome to the Modern Relationship Channel. Today I'm sitting with Dr. Richard Frank. He's the director of cancer research at Norwalk Hospital, and he's written a terrific book, Fighting Cancer with Knowledge and Hope, and it's published by Yale University Press. Thank you, Dr. Frank, for being with us today.
Thank you.
Now, today we're going to talk about recent breakthroughs in cancer treatment.
Yep.
Would you tell us about what's going on out there? Because this is important information for people who have been diagnosed and things are really changing.
Yeah. First of all, there are some cancers that are highly curable, early forms of breast cancer, colon cancer, etc. There are some cancers that I put in there that are easily curable. There are some that have been cured with recent breakthroughs in medications. And then there are others that remain very difficult to cure. We know the names of them: brain tumors, pancreatic cancer, when cancer has spread to other parts of the body from the GI tract. These are very difficult to cure. But what's happening is there's an explosion in understanding the DNA of cancer, and many centers are now analyzing the cancer specimens of patients for specific abnormalities that can be targeted with drugs that are pinpointed to that abnormality, and that's going to overtake cancer treatments over the next decade. And the second is major advances in immune therapies, harnessing a patient's immune system to target their cancer.
So this is the personalized cancer care we were talking about a little earlier?
That's right. Personalized means that if you analyze a tumor's DNA, it's unique to each patient, and there are certain changes in the DNA that will be susceptible to drug therapies that are in development. So it really is targeting the treatment to the patient.
It's very, very hopeful. And you also mentioned immune therapies. What are those exactly?
Right, so we all talk about immune cures for cancer. That's clearly all over the web and the internet, and there are people who basically are salespeople saying they can cure cancer with mild therapies that are not true therapies. It's taken only until 2 years ago for the first true immune therapy to be approved for use in patients that's in melanoma. What it is it's a protein, it's an antibody that goes into the immune system and releases the block of the immune cells against the cancer.
So is this like a vaccine? Do you get a shot? Is that what it is?
It's a drug treatment.
It's a drug, okay.
The problem with cancer is not that there is not an immune attack, because there is an immune attack, but the immune attack is blocked by the cancer cell. And the new drugs release that block.
That is fascinating. So it really is important for patients to be up on the most recent breakthroughs and to really educate themselves. Now you say there's some important resources out there. Where do you suggest patients go take a look?
Yeah, knowledge is power, and that's the best thing that a person can do with cancer. And so they should speak to their treating oncologist about treatment options, seek out other research institutions that may be nearby, and I put a host of resources in the book about where to seek the newer treatments. Thank
you, Dr. Frank, for being with us today. I've learned a lot. I guess the big takeaway here is if you've been diagnosed with cancer, read everything you can, get up on your resources, know what the latest technology is and the breakthroughs are, and of course, pick up Dr. Frank's book. It's terrific, Fighting Cancer with Knowledge and Hope, published by Yale University Press. You can find out more about Dr. Frank at his website, richardfrankmd.com. Hi, I'm Trevor Crow, and welcome to the Modern Relationship Channel. Today I'm talking to Dr. Richard Frank, and I want to know the 3 top things a cancer survivor should know. Think about.
One is dealing with the fears of recurrence. Once a cancer has been treated, every patient wants to hear their oncologist say, "You're cured."
Great feeling.
Something I try to say, but you know, it's funny, you can't find that in any cancer book that teaches doctors about cancer. They don't use the word cure. But I think after a certain number of years, a patient can be considered cured, but still there will be a lifelong concern for recurrence of that cancer or the development of new cancers. Certain families are predisposed to the development of multiple cancers, so it's important to know what the screening guidelines are for detecting new cancers, still staying in touch with your oncologist probably for most of your life, and also coordinating that with your other healthcare providers, your primary care doctor. In terms of the psychological effects, those are extremely difficult, to control your thoughts and deal with the fear of recurrence. I think if you understand the risk of recurrence and what actions you can take to catch it at its earliest, if it is destined to occur, and also how to improve your whole life, appreciating every moment. Someone said we only have moments to live, because everything is about now, and repairing all your relationships and doing the best you can to live well.
Well, thank you, Dr. Frank. We have a lot more coming up, so stay tuned. Hi, I'm Trevor Crow, and this is the Modern Relationship Channel. Today, we're talking to Dr. Richard Frank. He is the author of Fighting Cancer with Knowledge and Hope, and I want to ask him about organizing your support system, because this, if you get a diagnosis of cancer, it's got to be terribly scary. How do you get yourself ready? How do you get your loved ones ready? What do you suggest people do?
I think it's clear that patients who have a good support system, who have loved ones who help them, live longer. There's no doubt about it. And that can be your church group, your friends, obviously your close relations, husbands, wives, boyfriends, girlfriends, whatever, the people that are really going to be with you. And to that end, I think it's important to understand when you have cancer, what is the real prognosis? We've talked about that there are advances and there is new research, but still people are dying of cancer. And it's important to know if this is a cancer that's likely to be beaten or not likely, and if you're going to be living with it for the rest of your life, and to discuss that reality with everybody who's important to you so that they know they're on the same page and they're not guessing, and they can support you in the right way.
Very important words. Thank you, Dr. Frank. Again, organize your support system. If you do get that diagnosis, those around you, loved ones, can help you, support you, make you feel better, and give you a reason to live. So thanks for watching. This is Trevor Crow. Be sure to pick up Dr. Frank's book, Fighting Cancer with Knowledge and Hope.